John Upson isn't center stage, and that's just how he likes it.
I get to disappear on stage.
He doesn't play for recognition or fame.
I don't do it for money, I don't do it for anything, just for the fact that I love it.
Severe pain in his stomach forced him off stage and into the OR. Doctors told him he had appendicitis.
And went in there to take it out, and it wasn't what they thought it was.
John suffered from something called jelly belly. A tumor on his appendix burst, sending cancer cells throughout his abdomen.
The tumor gets blown up like a big water balloon, if you will, and it just bursts.
Surgical oncologist Andrew Lowy removed John's tumor and then gave him a chemo bath.
We're actually simply pouring the drug right onto the tumor.
Then the incision is closed.
So we push on the patient's belly from the outside to help ensure that the fluid is circulating equally.
The chemo is left in the abdomen for 90 minutes and then sucked out.
Sometimes tumors that have spread into the abdominal cavity don't have a very good attachment to the bloodstream, and if they're not well attached to the bloodstream, when you give drugs through veins, the drug doesn't get to the tumor cell.
It's a higher dose of chemo than traditional IV chemotherapy, and patients experience fewer side effects like hair loss and nausea because the amount of chemo that gets into the bloodstream is much less. The latest tests show John's cancer cells are gone. He's making sure not to waste this second chance.
It definitely hit me hard because cancer doesn't really play by any rules.
I'm Melissa Medley reporting.